HIV stands for Human Immunodeficiency Virus. It leads to Acquired Immune Deficiency Syndrome, or AIDS. HIV destroys specific blood cells called CD4 plus T cells, which are crucial to helping the body fight diseases. HIV belongs to a class of viruses called retroviruses, which are characterized by the way that they infect host cells. The genetic material in a retrovirus is RNA, which is injected into the host cell where it is reverse transcribed into DNA and inserted into the host cell's genome. The host cell treats the viral DNA as part of its own, and the host cell's machinery is used to build more virions, which are then released from the cell and go on to infect more host cells. Within a few weeks of being infected with HIV, some people develop flu-like symptoms, but others have no symptoms at all. People living with HIV may appear and feel healthy for several years. However, even if they feel healthy, HIV is still affecting their bodies and will eventually lead to AIDS. Current medications can limit or slow down the destruction of the immune system, improve the health of people living with HIV, and may reduce their ability to transmit HIV. Thanks to recent advances in medication, people can live much longer than in the past, even decades, with HIV before they develop AIDS. AIDS is the late stage of HIV infection, when a person's immune system is severely damaged and has difficulty fighting diseases and certain cancers. At this stage of the disease, the infected person is vulnerable to opportunistic infections that they would not normally be susceptible to. Thus, HIV is not directly fatal. It kills by making the body susceptible to infections and other types of diseases that a person with an uncompromised immune system would be able to fight off. At this time, there is no cure for an HIV infection. Tuberculosis, or TB, is a contagious bacterial infection that involves the lungs but can spread to other organs. In healthy people, infection with TB often causes no symptoms, since the person's immune system acts to wall off the bacteria. However, if the person's immune system is compromised, for instance they are co-infected with HIV, a TB infection can be deadly. TB is the leading cause of death among people living with HIV, accounting for 25% of HIV-related deaths in 2011. In South Africa, it is estimated that 18% of people between the ages of 15 and 49 are HIV positive. Almost 1 in 3 women between the ages of 25 and 29, and almost 1 in 4 men between the ages of 30 and 34 are living with HIV in South Africa. Our HIV awareness workshops aim to fight this epidemic by increasing people's awareness and knowledge of HIV/AIDS and TB. The workshops cover various topics, including the basics of the virus, facts about transmission, the link between HIV and TB, prevention of HIV, testing and treatment, and the effects of prejudice. Before the workshop, make sure that you know which workshop you are doing that day and that you are familiar with the content, and ensure that you have a sufficient number of worksheets copied to take with you. At the beginning of the workshop, introduce yourself and tell the children where you are from. Then fill out the register and begin with the workshop. To each workshop, you will need to bring the workshop outline and register, enough worksheets for the number of children, pencils and colored pencils, paper, and any other materials needed for the workshop, such as soccer balls and bibs.